This is episode 17 of the Women Inspired podcast. You are about to meet a badass. Welcome to the Women Inspired podcast. I'm your host, April Seifert. There is nothing more powerful than a woman who is inspired to action, and that's my number one goal, to inspire you, my listeners, to take action in your lives. Each week, I get to interview some of the most inspiring women, and I'm bringing those interviews to you. Let's do it. Dr. Ashley Smith is a clinical psychologist who specializes in the treatment of anxiety disorders. Her first book, called Childhood Anxiety Disorders, is coming out in April. After working at a nationally recognized specialty center for years, she is branching out on her own by starting a private practice. She helps individuals learn to embrace uncertainty, face their fears, and lead a life that is not ruled by anxiety. Ashley is also legally blind. With a rare, untreatable retinal disease, Ashley knows what it's like to face uncertainty. Despite doctors predicting the contrary, her vision has worsened significantly in recent years, making daily activities she used to take for granted, like driving, reading books, and recognizing people across the room, impossible. As her vision has declined, she's also had to learn to adapt. She will readily admit that living with a disability is a scary struggle, but she strives to keep it from defining her or holding her back. Those professional skills of hers definitely come in handy. Keep an eye out, pun intended, for her blog called A Blind Quest for Happiness, which she hopes to launch later this year. Ashley grew up in Arkansas, she went to graduate school in Nebraska, and she now lives in Kansas City. She enjoys ballroom and swing dancing, and she has a few amateur comps under her belt. She enjoys reading, thank you adaptive technology, and traveling. She thrives on new experiences and believes that boredom is the antithesis of happiness. Well, Ashley, welcome to the podcast.
Thanks, April. I'm so excited to be talking with you this morning.
Well, we are very, very excited to have you. And I think this is going to be an awesome conversation, knowing a bit about your background. But before I get too ahead of myself, help us get to know you a little bit. Just tell us about yourself.
I was born and raised in the South. So I grew up in Southwest Arkansas on the border of Texas, and I grew up with my mom and dad, and I had two younger brothers. Went to college in Arkansas, and then majored in psychology, honestly, because it was the only class that I didn't fall asleep reading the textbook. And then when you get into psychology, you realize, hey, you really kind of have to go on, if you want to do anything with it. So I went to graduate school in Nebraska at the University of Nebraska, Lincoln. And then lived in Omaha for a couple of years after that, and then relocated to Kansas City about 8 years ago, where I've been working in practice at an anxiety specialty center. Free time, I like to ballroom dance. I like to travel, like to read.
Awesome. So tell us a little bit about where you're at today. What are you up to right now?
I am honestly in a really big kind of state of transition. So I've been at this anxiety center for about 8 years now. And honestly, it was my dream job when I landed it. So I was like 29, landed my dream job, and it was great. And then kind of over time, I just kind of realized I wasn't growing anymore, and I was getting a little bit bored and needed a new challenge. So right now I am super excited about my next step, which is I am scaling back my hours, and I'm going to part-time, and I'm opening a private practice. Yes. So I'll still be doing the anxiety stuff that I really love, but I'm really kind of on this mission to redesign my life in a way that that doesn't kind of make me a slave to like the 9-to-5 work come first sort of thing. So I'm really excited to be doing that. And actually in the last year, it's part of my mission of like, hey, I need to get interested and excited about things again. I took on some new projects. So I wrote my first book, and it's coming out mid-April. So I'm really excited about that. It's a super nerdy, like quick and dirty textbook on treating childhood anxiety, but it's a pretty big personal accomplishment. So private practice, and then the book comes out, and then my next adventure is starting a blog. So that'll be new and overwhelming because I'm not tech savvy at all. So I'll probably be hitting you up for some guidance along the way, but I'm really excited about that too.
You have a ton going on. That's crazy exciting.
Mm-hmm.
So I want to just jump a little bit into, just before we move on, I want to give people a little bit of a sense of what your day looks like. So as you are seeing patients and that type of thing, what does that look like for people who aren't in, in psychology or in your type of field?
Yeah. So first of all, let me say I don't do the touchy-feely type of psychotherapy. I'm very much a scientist at heart. So I do what's called evidence-based practice, meaning that science shows it works. And I'm a very directive person just by nature, and that certainly translates to my practice as well. So on a typical day, I sleep in. I'm not a morning person. So get to work and I see anywhere from like 4 to 7 patients, ranging from kids to adults, and with all the different kinds of like anxiety or obsessive compulsive disorders, sometimes eating disorders, or other kind of like compulsive habits like hair pulling and skin picking. Meet with people anywhere from like 30 minutes to 2 hours, kind of depending on what they need. And I see people sometimes once a week, all the way up to daily for a brief period. So I meet with them and we're working on their symptoms and really getting to understand like, this is how anxiety works in your brain. And this is how your thoughts and your feelings are all connected, and how you can use your behaviors to change how you feel and to change how you think. So I spend a lot of my time like in the room with people, really kind of helping people face their fears is what it boils down to. It's like, you're anxious, so what? We're going to face this fear. That's the way you train your brain to not be anxious about it anymore, or to learn like, hey, I don't have to let anxiety stop me. Then I have to do a bunch of paperwork and some phone calls and emails. And then after work, it's anything from I mean, I'm not gonna lie, I like Netflix, or dancing or reading, or I like to cook. So I do that kind of in the evenings right now.
Nice. So, okay, I'm going to jump into kind of the meat of why
Mm-hmm.
I was so stinking excited to talk to you. As you've just gone through, you have a ton going on. You're super dynamic. You're writing a book, which is you wrote a book, which is an amazing accomplishment. Starting your own gig is no laughing matter. I mean, that is a huge thing to take on.
Mm-hmm.
But, Ashley, one of the reasons why you and why your story is so inspiring to me is the way that you have handled an adverse health situation. So I think people could look at you and hear this interview up to this point and think, wow, this woman's, kicking butt. Look at her. She has all this stuff in place. But you're doing this in spite of a physical challenge that has been thrown your way that would seem huge to a lot of us. So can you just tell us a little bit about
Sure.
what's going on with you there?
Yeah. So, like bottom line, I'm legally blind, and I always have been. But I have a rare retinal disease. I'm super special. Seen lots of doctors, and no one can really tell me what's going on. So I say that with a little bit of sarcasm, but so I was born with a degenerative retinal disease. And so what that means, like if you Google macular degeneration, those symptoms sound kind of like mine. So for a really long time, it was just like, I just can't quite see some things. Nothing's blurry, but I just can't quite see things. And I remember like in the 6th grade, being able to read the chalkboard from the back of the classroom. 7th grade, I just couldn't. It was just kind of gone. And then over the years, it's been a part of who I am. And in the last couple of years, like the last 2 years specifically, it's really progressed and progressed pretty rapidly. So I went from the doctor saying, yeah, we don't really know what's going on. And honestly, when I was younger, I had doctors telling me there's nothing wrong with me. It's all in my head.
Wow.
Yeah, which is really frustrating but we're kind of conditioned that doctors know all. And honestly, modern medicine can't answer all of the questions. So it went from that of like, no, there's nothing wrong. We don't know why you can't see, to, oh yeah, it's definitely either retinal or optic nerve. We're not sure, but it's stable and it'll never get worse, to, oh yeah, it's really progressing and you may go blind. So at this point in time, basically it's a pretty significant blind spot in the middle. So what it looks like for me is like if you just kind of like if you're in Photoshop and you kind of just blur out the center so things kind of have a little bit of color but no detail, that's what it's like. And I don't have any sharp edges anymore. And so functionally what this means was I had to stop driving 2 years ago. So that presents a whole lot of challenges when you live in a city that doesn't really have great public transportation. And I am a pretty independent, like to be on the go person. So that's been a big challenge. And at this point, I'm having trouble with bright lights, essentially make it really, really difficult to see in reading print, seeing faces, things like that. So that's been a huge challenge. And it's been kind of a personal journey of overcoming what I now know is shame. For a long time, it just was kind of this secret, and I could fake it well enough that I didn't have to tell people about it, or I could tell and minimize. You couldn't tell by looking at me. And even now, sometimes if you catch me in certain situations, it's not always apparent. And on the one hand, that's really nice because that fear that people would judge or treat me differently, or kind of that just deep held belief that I'm flawed, I can mask that. But at the same time, then it's hard because I get mistaken for stuck up when I don't say hi to people. And I'm like, I'm not stuck up. I just really can't see you. And it's a little intimidating sometimes to walk into situations where I used to be really confident walking into. And it's like I'm walking into a room and I don't know who's there until I get really close. So it's also been kind of an exercise in uncertainty. So going from, seeing all of the specialists and hearing it's not going to change to, well, you know what, doc, it did. It changed a lot to you're going to go blind. And I'm thinking, well, maybe I am, and maybe I'm not. Maybe you're wrong again. So that's been a big exercise in dealing with uncertainty too. And to ramble on a little bit more, when I first stopped driving, that was kind of coinciding with really feeling kind of stagnant at work and needing a change in like my personal romantic relationships, and really just kind of feeling stuck and scared and like everything needed to change, but I couldn't move forward because I didn't know if I was going to physically be able to at some point just kind of get into this place of like, you know what, screw it. Like, I've got what I've got right now, and I've got really great coping skills as a side effect of the job if I choose to use them. So I don't know what the future holds, but I do know that I want to be happy and I want to live a good life that's full. And so I don't want to say I'm not scared anymore. I'm just not willing to let that hold me back anymore, if that makes sense.
That makes total sense. Oh my gosh. Thank you so much for sharing that and for, being here and being open to talk about this. Because,
Yeah.
All of us, we chatted a little bit before in kind of the pre-interview chit chat that I have with everyone. And, this, people who are listening to this, I want you to think about this as, yes, the specific situation that Ashley's talking about, but then two, think about it as a parallel to, a barrier that you might have going on in your life that might be throwing challenges your way or leading you to feel uncomfortable or uncertain or not as confident. And I just want you to have that in mind as we talk about the rest of the pieces that we're going to get into with this interview, because there's a really neat parallel here, I think, between, Ashley's experience and what other people might go through as well. So, you seem so confident and so sure of yourself today, but can you take us back to when you realized that things were starting to progress and that your vision was changing? I can imagine that was probably a pretty serious situation, and that you probably experienced a lot of emotions at that point.
Yeah. So for my vision, it's kind of gone through this. I use the term shifting. And so like in my like high school, college, it was all pretty stable. And I had like just the regular nearsightedness that got a little bit worse. So that's the part that makes things blurry, and that's correctable with contacts or glasses. And that got a little bit worse when I was in graduate school, just because we do an insane amount of reading and stuff. So that was all fine. But then when I was 26, I was an intern at a children's hospital. And that's when I had the first big shift. And it was like, for me, it kind of feels like if you sort of like cross your eyes, not all the way, but just a little bit to make the picture kind of wiggle. It does that for a couple of days, and I get like eye strain and headaches. And then just some stuff is missing. And so that happened at 26, and then it stabilized again for a few years. And then at this point, it all kind of runs together. I had another couple of shifts, and then it seems like the last couple of years, it's been much more like the shifts are happening more frequently. Like I noticed another shift this week even. So it got to the point where like I drove, and then I had to have a telescope device to legally drive. And I just kept it in the car because I didn't really need it. And then I noticed that I started to need it to feel safe driving. And then it got to the point where even with that, I wasn't feeling super safe. I wasn't really trusting that I was going to see things. And I started to kind of think like, oh my God, how bad would I feel if I caused an accident or got in an accident? So that was really kind of the most concrete, salient impact on my life, was deciding I can't safely drive anymore and giving up some of that independence. And then since then, it's continued to shift. So like I've noticed when I'm at the gym or the dance studio and I'm in classes, like the instructor's not as clear anymore. And so like I noticed some of those things. And I spent, I was kind of socially anxious as a kid, worried about being judged. And it's kind of ironic that that's what I ended up studying, like from a research standpoint in graduate school. It's like, oh yeah, that was me. That makes sense. So I don't really have any more of that anxiety. But I felt really self-conscious about this. Like I'm pretty confident when it comes to like, if you don't like my personality, fine. If you don't like I'm pretty blunt. If you don't like that, fine. Like those things that feel like more of a choice, I'm really okay if people don't like that. But for some reason, this feels like some kind of like fundamental part of me that I don't have any control over. And that kind of makes me flawed and less than. And that's been something that I've really struggled with. And when it got to the point where I couldn't hide it anymore, honestly, what happened was I didn't recognize a patient in the waiting room, and she was here with her family to see another clinician. And I just kind of walked by. I didn't know she was here, but I didn't recognize her. And it really upset her because she didn't know that I had a vision thing. So she took it as I was upset with her because she wasn't doing a good job in her treatment. And so that was the first time I had to tell a patient, actually, no, I'm visually impaired. I genuinely didn't know it was you. And so, and that sucked, honestly, like that. I felt so bad for her. It didn't feel comfortable for me. But then a little while after that, like I run a monthly support group for people who have body focused repetitive behavior disorder. So these are people who compulsively pull their hair or pick their skin. And they talk a lot about shame and about when do you kind of, in quotes, come out to your loved ones. So I remember the first time that group was really the first place where I just like put it out there. And I was like, well, I'm legally blind. I have some trouble seeing your faces around here. And I remember like my cheeks were flushed and my heart was pounding. And like, on the one hand, I'm like, oh my God, this is terrible. Like the personal side, and the professional side is cracking up a little bit. Like, this is your anxiety response. Wow. This is what you coach people through every darn day. Buck up, like just be brave. You know what to do. And what I can honestly say is that like now sitting here talking to you, I don't have that physiological reactivity. I'm much more kind of matter of fact about what it is. And some of that is like, you have to kind of be brave and put it out there. And I find that as I do that, one, the response I get from people is usually a positive one and a supportive one. And it doesn't change like my day to day, what I can and can't see, but I'm also not carrying around this burden of shame or embarrassment that goes with it, or this fear. And I'm getting a lot better about being able to ask for help and say, I can't read that. Can you read that for me? Or, and it's a vulnerability that's uncomfortable. And I think a lot of women, like, it kind of sucks to feel vulnerable. And yet that's also a way that you can really kind of be more yourself, and I think more engaged in life in an authentic kind of way. And I'm not there every day. And certainly there are days where I want to like lay on the couch and wallow and feel sorry for myself because this sucks. But at the same time, that doesn't help. Like, that doesn't help me do anything. And it certainly doesn't help me feel good. I know I shared with you, like, the best piece of professional advice that I ever got was a meme on Facebook, but I use it in my personal life and I share it with my patients. And it's the phrase that just because life gives you a cactus doesn't mean you have to sit on it. And kind of the translation for that is also like the serenity prayer, or like the Buddhist saying, like, pain is inevitable, but suffering is optional. And some things were just dealt with. And that's out of my control and out of your control. And you can't do anything about that. But there's so much stuff that is in your control, your mindset, your life, like the things that you choose to do. And I think being brave and not letting that stuff hold you back, not to be an excuse, is a really important thing to do.
That's phenomenal. I'm thinking about, it's so interesting, actually, the combination of things that you have going on, that you've got this situation where, you're experiencing vision loss and all the emotion that comes with that. But then also, having been an anxiety practitioner, you probably have a lot that comes from that will allow you to help cope with it. So let's go into some practical advice here. Like,
Sure.
what would you say to people, who need help coping in this way?
Yeah, I think, be an anxiety specialist. Nice side effect of the job is great coping skills. But like, joking aside, there are a couple of things. I'm a behaviorist at heart. And what I mean by that is, like, I view the world in terms of processes and reinforcement. So like cycles that feed themselves. And that's the basis of the kind of therapy I do, which is cognitive behavioral therapy. This idea that thoughts and feelings and behaviors are all linked together. So, in a nutshell, and this isn't my example, but it's one that I use all the time. Like, I think of it like stepping in poo is kind of how I teach people. Like, if you're walking along and you step in a pile of dog poo, you can think, oh my God, I can't believe that I just stepped in the poo. And then what if it ruins my shoes? And then what if everybody thinks that I stink, but I didn't stink it? Oh my God. And you're going to feel really anxious. And that's going to drive your behaviors of, like, you're going to be checking your shoe. You're going to be backing away from people. You're not going to be engaged in that moment. Or you can walk along, step in that pile of dog poop and think, oh my God, I'm so stupid. This is just my luck. No one else would do this. Today's going to suck. And you're going to feel depressed. And I guarantee the rest of your day is going to go in a really crummy way. Or you can step in the poo and you can think, that stupid son of a, they shouldn't be allowed to have a dog. And you're going to be angry. And you're going to be moving in this like forceful manner and slamming things around. Or you can step in the poo and you can think, that stinks. Oh, well, not that big of a deal. Wipe your shoe off and go on about your business. And
I love that we're talking about dog poop right now.
Right? I mean, and I do this. Oh my God, I can't tell you how many times. And I do this because, when it's like, oh, you need to look at your thoughts. People are like, yeah. But I'm like, do you remember talking about stepping in poo? People will remember that. And like, so my vision is definitely a poo situation, but so is getting chewed out by your boss or someone driving really slow in front of you. Like, life is full of this, but the part you can control is your reaction. And like, I think our brains are really big liars, and learning to recognize what your thoughts are. What is your brain telling you? And recognizing, like, just because you're thinking it doesn't mean you have to buy it. You don't have to believe it. You don't have to act on it. Like, I think so many people, a lot of women have that inner critic, that voice saying should. So practically speaking, one of the best things that I've done for myself is ban the word should from my vocabulary, both mentally and externally, because should means you didn't do it well enough. Should means you made a mistake or you failed in some way. That's going to set you up to feel guilty or anxious. And when you should on other people, he shouldn't have said that, she should do this. That's going to make you feel angry. But if you're also communicating that in your relationships, what you're actually saying to that other person is, you're not good enough. You made a mistake. So practically speaking, ban the word should. Practically speaking, ban the what ifs. What if is always anxiety talking. So I really like to focus more on like what is, not what if. And that's been good for me because what if in 2 years I can't see anything? What if in 6 months I can't practice anymore? And that took me to like a really scary place. And the thing is, then it was taking all of this mental energy. I was like really wallowing in like fear and doubt and sadness and grief. And that hasn't even happened yet. And it may or may not happen. So I'm really trying to work on like what is. Okay, well, what is right now? I have to use some assistive technology. Okay, that I can handle. So I like that a lot. And for me personally, I also use a lot of like, in this moment, I'm okay. So staying in the present, anxiety will take you to the future. And I mean, anxiety's job is to keep you safe. It's looking out for danger and the bad things that could happen. But a lot of the times they don't, or things end up a whole heck of a lot better than you think they will. So why not go for it and then deal? So those are some of the things that I use. Behaviorally speaking, I think like our day-to-day habits make a big impact on us. And I'm not always great about practicing when I preach because, again, I love the Netflix. But when you look at what do you do on a daily basis and does it energize you or does it deplete you? And that's part of what I'm realizing now of like I've gotten into bad habits of checking email 20,000 times a day. Well, that's not a good use of my time. One, I'm not productive and efficient. And two, I don't think checking email right before you go to bed helps you because then you've got work problems on your mind. So bring that in. Movement, like we have to move. At the end of the day, we're animals and our bodies were designed for movement, not to be sitting in front of a screen 24/7. So I think that's important. I think we need things that make us feel stimulated. Like what I realized with work is that I got really good at what I do and I stopped growing. And so now I'm trying to spend, instead of when I have free time, hopping onto Facebook, I'm watching TED Talks, something that makes me think or learning something new. Like that keeps me energized and that keeps me from being more at risk to kind of falling into those traps of feeling kind of down and out. So I could ramble on and on. So feel free to jump in any point here.
I love those practical tips. And you're so right. It's so funny because you say like, don't check email right before bed because then you'll have work problems on your mind. You're exactly right. And then at 2 a.m., at 4 a.m., at 5 a.m., you're waking up thinking about those things if you were able to fall asleep in the first place. Right. It's like, how do you save yourself from from these urges to do these things that are just not serving you? And I think it's what I want to encourage people to think about here is approaching this like a process. So as you notice one thing maybe in your day-to-day that isn't serving you, concentrate on that thing for the next couple of weeks and try to change that one thing. Exactly. Big overhauls are really hard to make. Big overhauls really kind of set you up for failure when you try to change too many things at once. If you need another sort of backup of this, go back to one of my previous episodes about Jenny Evans, Unleashing Your Inner Powerhouse. She talks about, don't try to change everything all at once because it just sets you up for failure. So if you can find these things and slowly change them over time, I think your day-to-day is going to be so much more calm. And God, I love the whole point about eliminating the word should.
It's the worst
there's a million things we're supposed to do, like a million shoulds that other people put on us. It's just crushing to think about. I love that advice to just get rid of it.
Yeah. I find that like if you can reword it, that can help you clarify like what's truly a value of yours versus what's a societally imposed should or a family should or your own. I know in some of your other podcasts, you've talked about like self-limiting beliefs. And I think that's huge. And that's kind of what I was saying, like, brains are liars and we give ourselves all of these shoulds that really, if we stop to examine it, don't matter or aren't important. And I think that that's part of what's really freeing, is to look at, okay, what's actually important to me. And then, and honestly, like the whole idea with anxiety is face your fears. It's called exposure, right? Face your fears. You habituate, your brain gets used to it and stops giving you fear signals. But I think that translates, not just from anxiety disorders, but to broader life of identify what's important to you. What are your values? And if your day to day isn't in line with your values, you're going to experience discontent. You're not going to be happy or fulfilled. If what's important to you is your family, but you're spending 60 hours at the office, there's a discontent there, or there's a mismatch. So you're not going to be happy. If what's important to you is helping others, but you're too busy, I don't know, doing other things, like it has to match. And you have to clarify what's actually your value, not this should, and not what's fear-based. Like I know when my vision really tanked and I was in the possibility of going blind was introduced, that was really scary. And I got all freaked out about, oh my God, how am I going to make money? And how am I going to live? And how am I going to be able to support myself? And at that point in time, I didn't really feel like I could count on the people who were in my life. And one, that's a signal of, hey, you need to find, I like the word, your tribe. You need to find people and use the people. And that's okay. Humans are social creatures by nature. And we were originally designed to live in packs and communities. And we don't have that as much in our day-to-day life. So that's okay. But then I was also just really worried about being able to financially support myself. And I'm not. And I've heard some people talk about like the mindset of scarcity versus abundance. And I was hearing that. I was like, oh yeah, that's exactly what was going on. And so now I'm kind of trusting that it's going to work out okay, and trusting myself that I am resilient, and I have skills, and I have people, and I have things will work out okay. And so let me focus on the moment and on the next step, and just one step at a time, and moving in that direction toward getting into a cycle that's going to feel good for me. And I know that isolation doesn't do it. Netflix doesn't do it. Facebook doesn't do it. Eating junk doesn't do it. And being stagnant doesn't do it for me. So finding those things and trying to build those in little by little makes a big difference.
Totally agree. One of the ways that I loved the comments you made about, the way that I talk about it is risk tolerance, but
yeah,
to me, the way that I've talked with other people about it is that it's this muscle that you have. And if you're constantly working it out, it's going to get stronger and your risk tolerance will be elevated. And I've seen it happen in my own life where I used to be one of the most shy people. I was very risk averse, socially very risk averse.
Wow.
And it was extremely difficult for me to talk to new people and venture out there. And I finally started working on it and just saying hi to somebody once in a while who I didn't know. I mean, that was like a tiny step, but it just bumped my risk aversion up just a little bit where, that threshold was a little bit higher. And the more you work on it, the easier it gets. Another episode that I'll send people back to, it's such a weird one to send you back to, but it was one of the first few that I released. It was Lynn Broberg's episode. She's the world champion skydiver. And one of the things she talks about is the anxiety that she feels still. Thousands of jumps in, world record holder. I mean, instructor, amazing woman. She's in this, she's been in this sport for years. She talks about the anxiety she feels when she goes up in the plane and the self-talk that she has learned to do. She's like, yes, I'm anxious, but I'm going to have so much fun, so I'm going to do it anyway. Yes, I feel anxious right now, but it's going to be so much fun, and that's why I'm here. And so something about that direction of your emotion to, the reason why you were there, the whole why behind,
absolutely
why you started down whatever path it is that you're on. Maybe you're not sitting in a plane that you're ready to jump out of, but the whole reason why you were thinking about quitting your job or changing relationships or taking on a new hobby or going to a new organization or whatever it is, yes, you might be anxious, but think about why is it important for you? And I love that message that you just gave.
Absolutely. Well, and the thing is, what you're describing with this saying hi to people and taking baby steps, I mean, technically that's called graduated exposure. And what happens, anxiety's job, again, is to keep us safe. So humans can't fly. We should be anxious. There's that should, but we are supposed to be anxious when we're at the, really high heights, because you could die. Like, I was at the Grand Canyon 2 weeks ago and sat on the edge with my feet dangling off, terrified. But I'm so happy that I did it, because it's that you also, when you overcome anxiety, you get this really cool sense of empowerment, because like being brave doesn't mean not being afraid. It means being afraid and doing it anyways. And so much of what we are afraid of or worry about or feel nervous about isn't actually life threatening. It's, so what if people judge, right? Like, you're not going to die of embarrassment. It's uncomfortable, but that's it. But we kind of respond to it the same way and let it hold us back. And you can reason your way out of it. That self-talk is critical. But the thing is, where anxiety really lives in your brain, it doesn't speak English, so you can't talk your way out of it. I like to tell people, it's like you have to kind of take it and show it. Look, brain, jumping out of a plane isn't really dangerous. I'm not going to die. I've got a parachute. I've done it 1,000 times. Saying hi to people isn't really dangerous. They're going to say hi back, or they're not. It's not a big deal. Get used to it. And that's such an incredible thing. So I very much agree with what you're saying of like that risk tolerance or anxiety tolerance is very much like a muscle. And the more you do it, it's training your brain. Your brain is just another part of your body. If you want to get strong, you lift the weights. If you want to feel confident, the only way I know to do that is kind of that whole fake it till you make it, like do it, do the things you would do, kind of override that anxiety. And then eventually it gets weaker. For me, this whole idea of you can make belief. So you can create the beliefs that you want to have, not by reasoning through it, but through your actions. And I realized like I have this faulty belief that I am flawed. And at the point, at that point, I believed it 100%. I could recognize that other people didn't share the same belief, but that was what I really 100% believed. And I'm still not to the point where I don't believe it at all, but it's definitely lesser. But the way I got there was because I could recognize, well, if I adhere to, if I let this belief that I am flawed be part of my identity, part of kind of my worldview, it's going to hold me back. And that's not the life I want to live. So I used my professional tools to say, all right, well, if I want to change my belief, then I have to act in opposition to it. What that really means is do the very opposite of what your brain is telling you to do. My brain says, you're flawed. You can't do those things. Well, I'm doing them. And in doing that, it's getting weaker and I'm getting more confident and I'm getting more okay. But that's really the only way I know how to do it is use your actions to kind of shut those voices up, to show them, hey, this isn't helpful. I don't want to keep thinking this way. So I'm going to quit acting that way, if that makes sense.
You are a serious badass. That's so
Thank
awesome.
you. I like to think that. And then I have the moments where I'm like, what the hell are you doing? Sorry, but like, what the heck are you doing here? But yeah, and it helps, I think, to surround yourself with people who bring that out, that inspire you and build you up and not the other way around. And I kind of, at this point, like to that note, I'm thinking of it as like, let's say each person, we're a seed, right? Like April, maybe you're a lily and maybe I'm a fern, and I will always be a fern and you will always be a lily. But the soil that I'm planted in is going to dictate whether I'm this like luscious, vibrant green fern or this wilted brown thing. And so that, I think, our environment really kind of makes a difference too. And that's your work environment, your personal environment, the people that you're with. And so kind of creating your environment in a way that's going to help you blossom and grow and be the best you is incredibly important. And that's part of what has also motivated me to change some of these things this year and to do some things differently, is because I want to kind of get to that healthy, rich, fertile soil and blossom.
You're so awesome. I'm like cheering over here, and I could keep you on this interview, I think, for the rest of the day, because I know personally I'm benefiting a ton from hearing this, and I hope everybody who's listening is getting a lot out of this. God, you're a serious badass.
Thanks.
You also mentioned that you're at the beginning stages of starting a blog. Tell us a little
Yes.
bit about what you want to do with that.
Okay, so putting this out there because then there's a little bit of accountability.
Yes,
And I
yes.
bought the domain name, but I don't know anything about building that yet. But it's called A Blind Quest for Happiness, and in my head, this is part entertainment, part inspiration, part motivation, and part self help. So I really want to blend what I know from a professional standpoint, because I have this unique skill set that honestly, it's not rocket science. I wish everybody really kind of understood how thoughts and feelings and behaviors all go together and some of these tricks and tips. So I want to blend that with my personal journey of trying to deal with vision loss and still build a meaningful life, and the lessons that I've learned along the way and the adventures that I've had along the way. So that is hopefully coming mid to late end of the year. So keep an eye out for that. No pun intended. And I'm really excited about that and to see where that goes. And honestly, April, it's kind of in this same journey I think that you're on of wanting to inspire and connect and get some really positive energy and momentum out there for us. So that's next up.
That's so awesome. I can't wait. And when you're actually up and running, we need to reconnect and either have you back on or feature you in some way on the site, because I think, well, I know from just from what we've gone through in this interview so far that the folks listening are definitely going to be interested and definitely going to be cheering you on, because your story is so powerful and it's so real. I mean, the fact that you've gone through what you've gone through and you're willing to say, yeah, that sucked in the beginning. I mean, and it still sucks, but I was stepping in dog poo left and right, and it sucked. And I, figured out a way to deal with it. I just love that you're so open about the fact that there has been a process that has gotten to you to the point that you're at. It's not just, you just landed there naturally, really easily, because that isn't how things work at all.
Mm-hmm. Yeah. Well, I would love that. I think that would be a really cool reconnection thing.
I love it. So the last question that I have for you today is one that I ask every single person who is on the podcast. We are compiling a Spotify Power playlist, which is a playlist of songs that are all curated by the women who have been on the podcast. And really the goal there is to have just a badass playlist that you can go back to and listen to when you need motivation and inspiration and want to sort of momentarily reconnect with these amazing women that have been in these interviews. And so I have to ask you for your contribution to the playlist.
I knew this question was coming, and I was like, oh my gosh, which song am I going to say? Which is funny that this question is the hardest one. I think at this point, the song that I'm really, really liking and kind of getting pumped just from like a high energy standpoint, it's Lady Gaga's Born This Way.
Nice.
And in that one, I haven't historically been a huge fan of hers, but for whatever reason, right now, that song is just kind of resonating and makes me want to dance around, which is, I think, great.
Yes, absolutely. That having something that pumps up your energy and gets you into that motivated, high energy state each day, the more it's like I said, it's a very rare morning that I'm not jamming out to something to try to get myself pumped up for the day so that I can get a lot done. And I love that contribution. I think it's perfect.
Cool.
Well, this has been phenomenal. This has just, you've done a number of incredible things. I mean, suffice it to say, you've completely inspired me, and I'm certain the people who are listening to this, but also you've given us some amazing, just actionable tips. It's great to have someone with your background on who, knows the science behind anxiety and can help us think about how to better manage it, because it's something that happens to every single person. We all maybe have our unique triggers that make us feel anxious, but I so appreciate that you've been willing to share some very actionable tips that we can all use. It's been great.
It's been a pleasure. And I'm so honored to be a part of this podcast. It's such an incredible thing that you're putting out there. And I know personally, I've really enjoyed the episodes that I've listened to, and I leave each one feeling pumped and inspired and just in this really kind of positive place. So thanks for what you're doing, April.
I really appreciate hearing that. That's so awesome. It's been great to have you on. Thank you for being honest and open, and we so appreciate it. Oh my God, you guys, I am on fire after that interview. Ashley is facing some serious adversity, and although it's not easy, she's working through it. I mean, she's thriving even. You can hear it in her voice with how excited she is for everything she's taking on and all of the new things she's doing. It's just really awesome to see. You know, uncertainty and adversity and fear are things that we all experience in our lives. And I hope some of the things that Ashley talked about and the tips she gave help you cope the next time these things crop up, because it's inevitable. It's going to happen to all of us. And I think it's important for us to have some of the things that Ashley talked about as tips, have them in our toolbox so that we have them ready the next time that, you know, we're afraid and we're a little bit uncertain about how to move forward. You know, I loved so many things about her interview, but one of the big things that stood out to me is her point about abandoning the word should. I could not agree more. If you visit my website at www.aprilseifert.com, you'll notice a tagline that says, "Life is short, break the rules." Ashley's point about abandoning the word should is exactly what I'm getting at with that. Life is so short, and you should live your life in a way that fulfills you, not just to play by everyone else's rules. And I totally just broke that rule because I just said should, but whatever. I'm just going to let that one pass. I also wanted to give a quick shout out to Courtney, who recently wrote me an awesome email. She said, I wanted to send a quick hello and thanks for your efforts. The podcast has been a tremendous pick-me-up at a time when I really needed it. Well, Courtney, your email was a tremendous pick-me-up. So thank you so much for reaching out. Thank you for listening. You just have no idea how much it means to me to hear from you. On that note, if you want to connect with me, head over to aprilseifert.com and shoot me a message, or you can join me on the Women Inspired Podcast Facebook page. If you're liking the podcast, I have 2 small favors to ask. First, if you could share it with 2 friends, that would be wonderful. And if you could pop over to iTunes and leave me a rating and a review, that would be great. You have no idea how much it helps. I really hope you loved this interview with Dr. Ashley Smith as much as I did. And until next time, have an inspiring week.